Somo by Doc and Zane. Welcome to another episode as we continue looking deep into salt. We need like 4 important elements to survive, and they are oxygen, water, sodium, and potassium. And today we continue talking about sodium in our body. The salt that we have been warned against for many years might be the solution for our nation's chronic disease crisis. Through different kinds of research from different researchers, institutions, religion experts, health professionals, and experiments, I have come up with all that I have to tell you today, though in a summary way. Health professionals have advised that too many sodium leads to high blood pressure and heart disease. But recent research is ruling out the long-held belief in question. Remember, in every business, owners will use another product as a bad product for their profit. Salt intake has become a global concern over the years, and it has raised a lot of mixed up in the society of whether salt intake is healthy or unhealthy. And is it the worst thing to consume, or salt is just another innocent bystander to blame for high blood pressure, heart problems, and other conditions? Though even after you listen to this advice, does your high blood pressure get better or cured? Or it's just that they keep on adding medication to take every day? It goes unchanged even after avoiding salt for too long, and you get other conditions on top of that instead. But have you ever asked yourself why I stopped salt completely, but still I'm not seeing any changes? And has anyone in your lifetime ever told you that salt or salt water cures almost everything? I grew up where we used to borrow salt with neighbors all the time. My grandmother will treat everything with salt water or pour salt on a wound, and all were cured. I grew knowing salt is something you cannot say no to, someone in need, unless you don't have it yourself. So let us also say no to our body when we crave for it. Unless nowadays, health professionals are asking us to lower the consumption of salt. Let's start with origin of salt. In early ages, humans used to obtain salt from eating animal meat, and after some years they discovered salt from vegetables as well. And later, they found seawater also gave salty flavor as same as salt from the animal meat. And their diet consisted of around 50% meat and 50% plants. And because of their large consumption of vegetable, the potassium level were leveling with the salt intake. Unless nowadays, most of us don't take a lot of vegetables, which are higher in potassium. And over many millennia later, the human hunter learned how salt could preserve food, cure heats, and heal wounds with its medicinal use. And they started trading salt with other different goods thereafter. Talk of healing wounds. It was recorded that hundreds of thousands of Napoleon troops died during the winter retreat from Moscow because their wounds will not heal due to lack of salt. And in the ancient Chinese philosopher used to call the salt the sweetest thing on earth. But in the last few generations, what do we value as sweetest? Let us know in the comment section about your thoughts. Before refrigeration was discovered, salt was the main antimicrobial and preservative agent, which helped to maintain the freshness of food for weeks and months. And it was so valuable that it used to pay Roman soldiers, and also it was a symbol of binding agreement. And the absence of salt, like in Roman table, was interpreted as an unfriendly act, and it raised suspicion to those who visited. So salt was life force of the ancient world. During World War II, soldiers used salt to assist combatants in dealing with hydration in hot jungle and desert environment. Let's touch on religion with salt. Salt in the Bible signifies permanency, loyalty, durability, usefulness, value, and purification. And in many cultures, they used to offer salt and bread to their visitors as a traditional etiquette. Also, it used to be sprinkled to prevent evil spirit from casting a spell on people and places. And salt in Quran, according to Islamic guidance, is named one of the best food one can take before and after meals. And it's recommended by one of the prophet, and he said, a person who does this act is protected from 70 types of diseases or curses, and leprosy being the minor disease that can be healed. According to Hinduism, they state that salt is on par with everything. No food tastes good without salt, and salt is the favorite with the ancestors. And when one is on their deathbed, salt should be given as a gift because it opens the doorway to heavens, according to Hinduism. Those long years ago, salt was used as a currency and it was considered a valuable commodity, almost same value with gold among ancient civilization, and it was known as a white gold. And most importantly, was used to preserve foods, as I said, and it was a key ingredient in the carrying of leather, and major important of it was and still is always used as a food flavor enhancer, and also is used as a color controller, binder, texturizer, and fermentation control agent. One could have a death penalty for smuggling salt. So funny comparing to this century, and this was serious that those who worked in salt company were exempted from being drafted into the army. The origin of the word soldier is related to someone who was paid in salt, and also from the salt we get salary. Salt played a prominent role determining the power and the location of the world's greatest city. As well, it is created and destroyed empires, and especially when the world considered a sea salt to be superior than rock salt. Dehydration was the earliest carrying process, and in order to preserve food during dehydration. Salt in its natural mineral form has been one of the oldest known diet supplements. There has been no doubt and there is no scientific question concerning the benefit of salt, particularly sodium for athletes involved in warm weather sports. And salt tablet has been used for more than 50 years in football training camps and has been successfully employed as a supplement to the sports drink supplement, like in races, also in marathon running, in cycling events. As year went by, meat intake was reduced. Researchers stating that meat intake has higher risk of heart diseases, cancer, diabetes, and stroke. And still, recent generation are not taking a lot of vegetable. So we are getting worse by the day, since no enough sodium and no enough potassium in our body, which means our bodies are crashing slowly by day due to lack of deficiency of important minerals. Now let's understand this salt a little bit. Salt is a compound in the form of crystal that consists of sodium chloride. Rather, it's ionic compound made of sodium ions and chloride ions. Salt ensures the transmission of electrical nerve impulses to and from the brain and the contraction of the heart and other muscles. It turns into electrolytes once it is dissolved in the blood and other bodily fluids. And sodium is the main positively charged electrolyte called cation, and it makes up the fluid that the cells bathe in it. While chloride is the main negatively charged electrolyte called anion in the blood. And both sodium and chloride are the electrolytes of the highest concentration in the body compared to other electrolytes. Iodine is a mineral we also need, and it's found in table salt, food, and fruits. It is also essential in our body since it's the main building block to the thyroid hormone, and its deficiency will decrease the body production of T3 and T4, enlarging the thyroid tissues, causing diseases like goiter, hypothyroid, or hyperthyroid function. Sodium and water do respond out on each other in a process called osmoregulation, and it responds whenever there is an increase in sodium concentration. The kidneys do reabsorb less sodium and excrete the excess sodium in the urine, and the normal serum sodium level are maintained at that point. And this mechanism do help to prevent cellular damage from fluids shifting in and out of the cells. But if sodium level drops too low, water from the blood will go into tissue cells in order to increase the sodium back to normal. Though this full shift can lead to cellular swelling. Remember that. But again, if the sodium in the blood goes up, the water will be pulled out of the tissue cells and into the blood in order to lower sodium levels back to normal level. Though this can also or as well cause cellular shrinkage. And that means both cellular expansion and shrinkage can be harmful, which is why our body will do anything to keep normal sodium level, and why the salt intake and balance are so tightly regulated. And if the body is not able to do this balancing, a low blood sodium can lead to too much water into the brain. Salt comes from sources like seawater and rock salt from drying up of the enclosed lakes and seas. And before it gets to shelves or stores, it goes through a refining process where impurities are removed and it is added anti-caking agent, which helps absorb moisture, and also iodine is added to help prevent iodine deficiency. Salt acts as a preservative by reducing the availability of water in foods, thereby depriving microorganisms from using available water as a nutrient and decreasing enzymatic activity. The growth of pathogen and spoilage microorganisms is avoided or delayed in the presence of salt. So why will this salt, with so much beneficial and have been used for thousands of years, should only in recent years be discovered to be so harmful to our health? And now they say that sudden increase in salt intake stimulates sympathetic activity on the central nervous system, while in former days it was considered to arouse passion and desire. And it was the first to be put on the table before food, and it was the last to be removed after the feast. What we need to know is that our body cannot function properly without adequate salt, and consuming little salt may actually increase the risk of heart disease. And we don't need to worry so much because the body will naturally excrete any excess unneeded salt in the body, and sodium and chloride play a vital role in keeping our bodies functioning. Like function of sodium is the transmission of nerves impulse around the body, and it regulates the electrical charges in and out of the cells. And by this it means fluids and vital mineral can be passed into and out of each body cell depending on its individual needs. And again, this sodium facilitates in controlling our taste, smell, tactile process, and helps muscles to contract. And one of these muscles is our core muscles, the heart. And always remember, sodium is an essential nutrient, but the body cannot produce itself. So for us to survive, we need to consume sodium regularly. And without sufficient sodium in the body, senses would be dulled and nerves won't function properly. And if you have low level of sodium in the body, you will have a condition known as hyponatremia, and it's very dangerous. And like function of chloride, it facilitates in digestion process. It preserves the acid balance throughout the body, and it helps to carry carbon dioxide from tissues to the lungs. And also, it aids potassium absorption as well as supplying hydrochloric acid in the gastric juices, which is used in the stomach to help break down and digest food and control the level of bacteria present in the stomach. And if we miss or lack these vital minerals, we will become weak. Our muscles will become weak and have cramp. So if you lack salt, we won't function properly, especially elderly people, pregnant women, and those individuals who exercise regularly, and this is because their body is under pressure. And for elderly, they don't drink a lot of water like young people. So during hot weather, they sweat and they don't replace the water and sodium needed to maintain their healthy body. And later it can lead to thickening of blood, which can increase blood pressure and can as well lead to heart attack or stroke. Salt is needed to maintain the optimal amount of blood in our bodies. It's even needed by the heart to pump blood throughout the body. Remember, a heart is a muscle and it needs sodium to function properly. Also, cell-to-cell communication, bone formation, strength, and prevention of dehydration. All this is done by maintaining the optimal amount of sodium in our blood. Salt is essential for human health to maintain plasma volume, regulating body water content and electrolyte balance, transmission of nerves impulses, and normal cell function. Now, salt is related to serious health problems like hypertension and cardiovascular diseases and knees problem. But what we forget is approximately 75% of salt we do eat is already in the food that we buy daily and naturally depending with individual eating habit. About 20% of salt we consume comes from food that naturally contain salt. In some people's kidneys, they have trouble keeping up with excess sodium because as it accumulates in the body, it will hold on to water to dilute sodium, and this will increase amount of fluid surrounding the cells and the volume of blood in the bloodstream. And this results to more work of the heart and more pressure on blood vessels. If this continues over time, blood vessels will stiffen, leading to high blood pressure, heart attack, heart failure, and stroke. And in some research, they say one can damage the heart and kidney without increasing blood pressure, and it may be bad to bones as well. As I have mentioned, sodium will always find you wherever you are, so don't look for it regularly because you'll find it in a minimal from fruits, vegetables, meat, dairy food, and in whole grain. And a big percent, that's around 75 to 80% of salt that we consume comes from commercially prepared foods, rather processed food and restaurant food, and not from the salt we add while cooking at home, or even the one we add on the top, on the table before eating. The following statement is for those who think they do their best by avoiding table salt for their conditions. We consume more salt from commercial foods and the salt that is added during the food manufacturing or preparing process, and this causes consuming too much salt to be unavoidable if we primarily eat processed or packed food like pastry industry like breads, pizza, bacon, salad dressing. We have cured meat, soup, soy sauce, and savory snacks like chips. So it's about food industry and manufacturers to take action on solving the salt consumption dilemma, and they stop blaming the salt we cook with or added on the table, unless they want us only to consume their food or their product without cooking at home with salt. And for the food manufacturers who have reduced salt in their product, they have replaced salt with other ingredients that adds more flavor, and other ingredients are still unhealthy, which are some adds more sugar or some add saturated fat, and these two can lead to a whole slew of health problems. Let's prioritize eating whole fresh food and unprocessed food, and this means preparing fresh food for yourself as much as possible. I can feel we murmuring about this point because it means peeling, going to the supermarket, it means shopping, slicing, and collecting fresh food, which feel like a lot of work and a lot of energy, especially if you don't have enough time. But it's either you eat healthy and live without some condition or diseases, or you perish. Choice is yours. Salt is used as a health aid. For example, higher salt diet is usually used to treat what we call dysautonomia. Salt has been utilized to increase solubility of weakly acidic and basic drugs, and therefore dissolution rate of drugs or of a drug, and also salt is used to mask the taste of a bitter drugs. Salt formation has been utilized to increase transdermal permeability in things like creams, ointment, and gel. Sodium chloride is used as an electrolyte replenisher, which helps prevent cramps caused by too much sweating, and also, or as well, it is used for preparation of normal isotonic solution. Nowadays, fast-acting fizzy medication have raised in popularity, and the adverse effect of medication with sodium intake look to rise than fall. As much as we want to blame salt on our table and the food we cook with it, consider where else you get it from. And for those who have condition to do with sodium retention like high blood pressure, we have heart failure, renal impairment, and also individuals who have decided to restrict themselves from salt should also avoid regular use of medication as well, especially those medicine are containing high level of sodium, and some of these medication are over the counter, and even others can be picked in the supermarket. A big number of research have requested manufacturer to provide clear labeling of salt content in the medicine they make because they struggle getting the information and forced to call the manufacturer themselves many times to give direct details. And they notice people are taking soluble painkillers and other medicine which don't have clear content. To some people who take daily maximum doses of some drugs, do exceed recommendation limit of sodium even without any sodium intake from their food, and you still blame salt in our plate with diseases like high blood pressure. So now you know about medicine of soluble and effectiveness sodium containing drugs, and you should ask your doctor the type of medication they are giving you, and they will only prescribe those drugs if only the benefits outweigh the risk. And that is if you still think salt is the one giving you high blood pressure and other conditions. Like those who have chronic breathing pulmonary diseases, they do use sodium chloride inhalation medication, and it has been instrumental in providing drugs with much longer half-lives like salmeterol. So, sodium is everywhere. And for some drugs formulation types, it's more important to have a salt form than non-salt form. And injectable form have been approved than any other salt form since it achieves the desired characteristic in drug such as increased solubility for the parenteral route of administration. Since it achieves the desired characteristic in drug such as increased solubility for the parenteral routes of administration. Let's see some issues with deficiency and toxicity of salt. We have hyponatremia. Hyponatremia is abnormally low amount of sodium in the body, and it mostly occurs in older people. When one gets to have excess or severe vomiting or diarrhea or sweating, salt is lost and expelled from the body, and that only can lead to hyponatremia. You also get this deficiency when too much fluids abnormally collects in the body, which can stem from diseases like heart failure or liver cirrhosis, and in rare times you can get it from simply drinking too much fluid, and the kidney can't excrete the excess water. And its symptoms are things like vomiting or feeling nausea, headaches, confusion, altered mental status, seizures, lethargy, or even coma. And for the toxicity, we have hypernatremia. And this is when there is too much sodium in the blood. And it's an acute condition and mainly happen in older adults who are mentally and physically impaired, and those who don't eat or drink enough water, or if they have an infection that causes severe dehydration, or maybe they are vomiting or they are sick with high fever, excessive sweating, and are using diuretic medication that depletes water from the body. And also this condition, besides older people, we also have those with dementia and infants who don't have access to fluids and do have neurological or physical impairment. If salt accumulates in the blood, water is transferred from the cell into blood to dilute it. And this fluid shift and buildup of fluids in the brain, it can cause problems like seizure, coma, or even death. And if these excess fluids collect in the lung, it can cause difficulty in breathing. And as well, these people can also have kidney damage, intense thirst, nausea, loss of appetite, and body weakness. And for immediate symptoms of too much sodium in the body, there is increased thirst, swollen feet or hands, headache, bloating, and temporary rise in blood pressure. Potassium and sodium are interconnected, but they have opposite effect in our body. And they are both important with essential nutrients that have the key role in maintaining physiological balance. And as sodium is a link to chronic diseases, so as well as potassium is also a link to chronic diseases. What does osteoporosis have to do with salt? This is a bone thinning disease. Amount of calcium our body loses through urination increases depending with the amount of salt we eat, and if this calcium is not enough in our blood supply, then it can leach out of bones, leading to the word in the street that high salt intake is not good to our bones or joint or knees. So old people are advised about salt intake or increase in potassium, since it could slow the loss of calcium from bone that occurs with age. I have grown being told how salt is bad to my health because it can lead to diseases, but no one have ever told me that consuming less salt or not having salt at all is also not good or not healthy to my body. Remember, it's impossible to live without salt. And also remember, people respond differently in what goes in their body. So same to salt intake, that to some high salt intake might affect severely than others. But in case you feel you have taken more than enough, just compensate by eating potassium-rich food. Drink more water and eat salt moderately according to your weight, taste buds, your daily activity task, and according to the chronic disease that you have, if you have any. So not everyone who will get this effect, experience, or condition. Like some researchers suggest that those who are salt resistant may not experience a rise in blood pressure after taking a rich meal in salt or sodium. And those who are salt sensitive might be influenced by factors like hormones and genetic. Generally, guidelines advises a moderate rather than low sodium restriction. However, there is a mixed up research, and more than enough research and studies are needed on the effect of salt intake and its health. Now let us briefly talk about high blood pressure with salt. High blood pressure issue with salt started back then, more than 100 years, on a research of 6 patients only by 2 French scientists. Later, salt was started in the United States with a doctor from New York who first brought salt restriction issues which can lower blood pressure for of those who have hypertension. And the favor fell on them that it's true, low salt intake can lower blood pressure. And once the idea is entrenched in people's mind, it is very hard to supplant it. So they believe it's up to date. In year 2000, another doctor said low salt recommendations were based on data that had been amplified by publication bias, the tendency to publish positive rather than negative results. Another professor stated that salt diets would increase the overall stress on the arteries and hence increase the risk of hypertension and heart failure. So there is a need to look for consequences of salt restriction. When the salt intake is too low, the body will begin to activate rescue system to try retain more salt and water from the diet we take. And it will be bad since it will involve renin, angiotensin, aldosterone system. And this is known for increasing blood pressure. Then the sympathetic nervous system, which is known for increasing heart rate, and then arteries can become more constricted due to the depletion of blood volume, which is total peripheral resistant. This tells me that the low salt intake may actually be the cause of very disease that is being used to prevent and treat hypertension. Salt holds on to water in the body to a certain extent, which is not harmful to our body but actually a life-saving property. Medical field do know that kidneys can excrete massive amount of salt beyond what we normally consume in a day. And those with normal blood pressure excrete 10 times a normal sodium intake, up to 86 grams of salt a day. An advice from a doctor would be, instead of cutting in salt, we eat more potassium-rich plant-based foods instead of this low-salt diet everyday saga. And we are not asked to avoid sugar, which increases both blood pressure and heart rate, and as well cardiovascular event. They don't mention other things that can cause high blood pressure, which can be a result of dehydration, minerals deficiency, magnesium and vitamin D deficiency, high carbohydrates, high sugar diet. We also have inactivity and many other stuff that can lead to hypertension. Why don't they mention them? In the year 2013, major research institute reports found that there was no benefit of restricting sodium intake below 2300 milligrams per day. And restricting salt to those with hypertension, it increases plasma lipoproteins and inflammatory markers. While those with chronic high blood pressure, it increases low density lipoprotein, that is the bad cholesterol levels in the blood. And low salt also decreases high density lipoprotein, that is the good cholesterol, and adiponectin, a substance released by fat cells to improve insulin sensitivity. Another analyst, through their research, concluded that low salt diet might lead to an overall negative effect on health based on increases in hormones, bad cholesterol, and triglycerides. And also through the studies, they found low sodium intervention lowered blood pressure only minimally, like 2% out of 10%, while 8% out of 10% significantly raising levels of kidney hormones, stress hormones, and unhealthy triglycerides. Low salt intake has been thought to increase blood viscosity, the thickening of the blood, and it contributes to an increased risk of thrombotic vascular event like blood clots and deep vein thrombosis. It also increases fasting norepinephrine. That is a substance that increases heart rate. And when the heart receives blood supply, it releases it to other organs. And this happens when heart is contracting. And so the quicker the heart pumps, the less the heart relaxes to receive enough blood and oxygen. Which means it won't as well supply enough to the other organs, which is the reason why low salt intake have been implicated in increasing the risk of heart attacks by reducing blood flow to the heart, and may even produce cardiac hypertrophy, overgrowth of heart and kidneys, which can lead to heart failure and kidney disease. The same diseases they say are caused by high salt diet, and the guidelines of the low salt intake might have caused more heart diseases than prevention. Hormones like insulin and leptin may work against you in internal starvation, corrupting the internal process that regulate your use of fat and protein for energy. The body will hold on the small amount of salt that it will get. And one of the body defense mechanism is to increase insulin levels by creating a state of insulin resistance. And when the resistance kicks in, the body will be less able to shuttle glucose into cells, and it needs to secrete more insulin in order to control glucose levels, and these hormones will end up increasing fat absorption. The elevated insulins keeps stored fat and proteins locked away, making them unavailable to the cells that need them. And at this point, the only micronutrient you can efficiently utilize for is carbohydrate. And this makes one eat more carbohydrates so to get the energy, since you can't get it from anything else. And it keeps on triggering more insulin release, and this keeps on happening again and again. Also, low salt intake can develop an iodine deficiency, and an iodine is needed for a proper thyroid functioning. And as this continues, you might get, or you can get, what we call hypothyroidism, a condition which metabolic rate slows down and more fat is stored in the organs. Insulin resistance develops and weight gain occurs, and this will lead to internal starvation. Low salt intake also increases the risk of overall dehydration, and generally well-hydrated cells function much more efficiently and consume less energy than dehydrated cells do. And if our body have less energy available, the greater the internal starvation and the more calories you are likely to consume. And these physiological changes can make someone to become metabolically overweight or obese, even if it won't reflect on the scale as overweight. One can be thin on the outside and fat on the inside, which we also call it skinny fat. Through research and mounting evidence that your mother's salt intake while pregnant can affect your risk of experiencing internal starvation once you're alive, with more fat around your organs, obesity from day one. And also you can have abnormal leptin levels and be insulin resistant. And this insulin resistance and elevated insulin levels causes glucose to build up in the blood instead of being absorbed by cells for energy, which causes issues physiologically like overeating, excessive hunger, more fat storage in fat cells, and internal energy crisis. Since one effect of salt restriction is reduced blood circulation, that means less blood flow to the liver, and this will interfere with the liver's ability to break down insulin, which means high insulin levels. So that means always leads to the same venue, that is an increased body fat. So pregnant and lactating mother salt status can determine the ability or can control the future health of the infant and impair the health of growing child even into adulthood. Mothers needs a lot of nutrients so to meet the demand in order to supply the baby for proper growth and development, and salt is one of these nutrients. So restricting salt to pregnant or lactating mother will increase the vulnerability to their children to have hazardous outcomes. Like in pregnant, low salt intake has been found to cause hypertension and kidney disease in adult offsprings. And as well, it can cause children to develop abnormal lipids, diabetes, obesity. They can also have mental retardation and chronic kidney diseases. The same diseases we believe a low salt intake will prevent. So, our health agencies need to reconsider the advice they give to pregnant and lactating mothers during these critical times in human development. Also, pregnant and lactating mother needs iodine, since lack of it may lead to impaired motor function and growth and can cause what we call hypothyroidism and perinatal and infant death. And that's why a responsible nutritionist recommended dietary supplement should be included at least 150 micrograms of iodine in all supplements intended for pregnant and lactating mothers. If pregnant women consume too little salt when they are pregnant, the fetus will develop in a salt-deprived state, and dopamine receptor in the reward center of the fetus brain will become highly sensitized to salt, causing you to get amplified gratification from eating salt. And this may cause the offspring to eat and crave for more salt throughout their childhood or adulthood. And this can lead to risk of being addictive to drugs and refined sugar due to chronic activation of the brain's reward system. Researchers have found that the activity of brown adipose tissue, that is the good fat that burns calories, was reduced on a low-salt diet, indicating that low-salt diet may lower our basal metabolic rate and possibly contribute to accelerated aging. Overweight individuals exercise to lose the excess weight by cutting down their carbohydrates. And when you cut carbs, you become salt waster, since you are excreting more salt than you are taking, especially when you hit ketosis. So when on low carbs, please increase your salt intake, so to replace the loss by the kidneys and also to help prevent the subsequent rise in insulin levels to compensate for this loss, especially for the first 2 weeks of cutting on carbs. So when you see someone somewhere adding more salt on their food, don't be judgmental, but be happy for them, because it is their body guiding them that it needs more salt. And there is nothing like salt addiction. It's that they won't stop until their salt depletion is corrected. And immediately it's corrected, the inhibitory signal will turn off the liking for salt and turn on the aversion signal. It's been postulated that high salt diet during times of repletion causes the salt receptors on the tongue to flip from positive to negative, quite unlike the response of the other 4 basic taste sensors, and thereby tend to decrease intake of salty foods. Other research have suggested that high salt intake helps buffer the effect of stress, serving as an adaptive coping mechanism for dealing with psychological and emotional adversity. Also, it has a positive effect on moods. While it's commonly believed that consuming sugar or sugary stuff like sweets has a positive effect on mood, but it's a fleeting lift at best. If an individual opts to reach for sugar rather than salt, they may find themselves becoming dependent on sugar as a short-term stress fix. And the negative effect of that coping mechanism would only be heightened on a low-salt diet, leading to a perpetual cycle of medicating with sugar and eventually sugar addiction. More than 50% of total calories come from sugar in adolescent age, and sugar cravings are produced by either psychological desire or a physiological dependence on it. And remember, when the fructose is stripped out to concentrated form and added to other foods, it's become more addictive and harmful than its in original state. Now, why do this demonized stuff salt increases blood pressure to some people and the same salt does not affect others? The guidelines only tell us about avoiding much salt because it causes high blood pressure, but they never told us or mentioned the risk of avoiding it or taking in small amount. Blood pressure, stroke, and heart attack are fleeting measurements known to fluctuate depending on a lot of healthy factors, but the blame is always impacted by salt. After the not mentioning a lot of risk that comes with low salt intake that actually magnifies several side effects like increased heart rate, compromised kidney diseases or function, adrenal insufficiency, hypothyroidism, cholesterol, insulin levels, insulin resistance, obesity, and type 2 diabetes. And as we follow these guidelines, we are forgetting that we also do take medication that causes salt loss, causing more damage to our intestine that they can't absorb salt properly. Our body starts the panic mode when we restrict salt intake. And at this point, the body defense mechanism will increase the insulin level so to help kidney retain more sodium. But when insulin levels are high, they lock energy into fat cells where it will be difficult breaking down stored fat into fatty acid or stored protein into amino acids for energy. And when they are also high, the only micronutrient that can efficiently utilize for energy is carbohydrates, as I said earlier. And by this, the body starts craving refined carbs and sugars. And by this time, our body believes that carbohydrate is the only viable energy source that they have or they got. And did you know that salt is a natural contraceptive in human, both males and female? Low salt diet causes reduction in sex drive, reducing likelihood of getting pregnant, increasing erectile dysfunction. It causes fatigue, sleep problems, and women with salt-wasting kidneys due to a congenital adrenal problem have a decreased fertility and birth-child rate or childbirth rate. One of the paradoxes is the Korean paradox, where they take more salt than the recommended amount. And Koreans manage to have one of the world's lowest rate of hypertension, coronary heart diseases, and cardiovascular diseases. And other countries with the lowest rate of death due to coronary heart diseases in the world, and they all eat very high salt diet, is countries like Japan, France, and South Korea. Also, we have high salt eating countries and they have long life expectancies. Also, we have high salt eating countries and they have long life expectancies like Japan, which has the longest life expectancy in the world, and South Korean, which have the lowest rate of death due to coronary heart disease in the world, followed by France, Japan, Portugal, Spain. We have also Italy, Belgium, Denmark, Canada, Norway, and the list goes on and on according to the world ranking. Human body has a built-in system called thermostat that help us get the right amount of salt, and thermostat signals the brain to seek more salt when we need more to meet our physiological needs. And as well, it will signal the brain when to stop when we have enough to fulfill our biological functions. So the system will help regulate the internal fluid salt electrolyte balance and resets it when need be, and it works automatically without any effort on our part. On another hand, there are no signal that our body actually needs sugar to survive, like the way we need salt to survive. In those days, our ancestors would enjoy sweet food since they used to consume enough calories and nutrients from natural foods, unless latest century where we have modern food and the natural sugar from the whole food has been extracted and removed of its inherent fiber, water, phytonutrients, until all that is left is the chemically produced syrup. When we eat packaged food and beverages that are loaded with processed sugar, the body absorbs it rapidly and our brain registers an off-the-chart reward where there will be an intense release of natural opioids and dopamine that can override our self-control mechanism. So after eating these processed foods, which have large amount of refined sugar, it stimulates the brain's reward system called mesolimbic dopamine system. And when the reward system fires, it reinforces behaviors, making it more likely for us to carry out the same action again and again and end up being addicted, and with characters just like those who takes heroin, morphine and opium behaves or do. And after being addicted to sugar and tries to cut off, they do experience mood changes and behaviors, being unable to concentrate or think straight. They also might have shakiness, jitteriness, sweating, and anxiety, and as well have withdrawal symptoms, especially when they suddenly go too long without consuming sugar. Dopamine is the reward neurotransmitter that those who are sugar dependent may experience mild depression when they have less sugar, which they treat it by consuming more sugary stuff. And it causes them to have that burst of happiness for a short period, and when it's done, the depression episodes comes again and they treat it again with sugary stuff as well. And this disease of taking sugar becomes addiction, and the addiction continues through their lives. This is unlike our casualty called salt, where many healthy people don't need to worry about eating too much salt because the body will use what it needs and remove any excess. But for those who have some condition, should be concerned about consuming too much salt. Conditions like Cushing's diseases, Conn's syndrome, and Liddle syndrome. These people are supposed to monitor and possibly limit their salt intake because they might be sensitive to the negative effect of sodium in their blood pressure. Though the much salt is not the main issue here, or in them or towards their condition. Because if the underlying disease is treated effectively, then the excessive salt retention will be treated as well. When our body and fluid levels of sodium get high, our body start reabsorbing less salt from the kidney and absorb less from the food we eat, since our intestines make some of the adjustment for us as well as our bodies. When salt begins to accumulate, it tends to harmlessly shunt the excess salt to the skin or organs. And remember, bodies have significant sodium stores in our skin, which helps to prevent dehydration and blocks infection organisms from entering the skin. With our modern lifestyle, health, and habits, our body needs more salt because we do overconsume sugary things, which causes specific problems to our kidneys. Problems like causing salt wasting, and some medication we take daily as well, like dilutics, antidepressant, and some diabetes drug, which leaves the body susceptible to salt depletion. Our body being dependent on junky habits, alcohol, energy drinks, and other caffeinated beverages, which put us at risk of salt depletion as well. Because like caffeine, it acts as a natural diuretic, flushing water and salt from the kidneys. And diuretic and natriuretic effects of caffeine consumed by patient can solely lead to hyponatremia. Also, our habit of exercising, which almost everyone is doing it, and this exercise do cause us to lose salt and water. And a good number also those who are fasting with low carbs diet, and as well those who are doing long intermittent fasting diets, which causes massive losses of salt and water from our kidney, and we don't replace the lost salt due to either lack of knowledge or ignorance. And this inadequate salt can make it harder for our bodies to activate fight and flight responses to deal with physiological stressful situations like blood loss, heart attack, stroke, and gastrointestinal infection. We have what we call salt set point. Salt set point is an unconscious level of sodium intake, which is controlled by the salt thermostat, which responds to our body if salt is high or low, depending with our body's need, such like if you're having a salt wasting kidneys, you may need more salt because you are losing more than that person who has a healthy kidneys. Salt can be maintained at the salt set point, but it is as well occur after 4 to 5 days of salt restriction. This is because it takes that period for our kidney to slowly turn off the salt, spilling out of them, and after those days the body will finally shut the sink off so that you can maintain salt balance by consuming as little as 300 milligram per day for those with healthy kidneys. When on low salt diet, you may require the activation of certain rescue system or salt retaining hormones, which have been consistently found to induce harm. And these salt retaining hormones can harm the body's organ and may cause hypertension and other health consequences by causing enlargement and stiffening of the heart and blood vessel, which is why low salt diet are associated with greater cardiovascular risk. When consuming less sodium, the kidneys generally excrete less in order to maintain normal sodium balance and normal extracellular fluid volume. Though, if there is any problem in your kidney's ability to retain sodium, then you become deficient in sodium quickly. And you can experience this during hemorrhage. The kidneys almost immediately do shut down sodium excretion so to maintain blood volume in the body. And if the kidneys are unable to do this, like to those individuals with this condition we call tubulointerstitial damage from overconsuming refined sugar for many years, their bleeding event could be disastrous, and especially if the intake of salt is restricted in them. Always remember, salt surplus keeps your salt retaining hormones down, protecting your body from wear and tear on vital organs. And when salt is restricted, it also reduces urine volume, which can reduce the ability of clearing metabolic waste from the body and increasing the risk of urinary tract infection, since we rely on frequent urine flow in the urinary tract to get rid of bacteria which act as a flushing out the system. We lose body fluid through bleeding, burns, trauma, vomiting, and diarrhea in a state of shock. And salt can help our body withstand accidents and traumatic events where the injured body parts draws fluids to speed up the healing process, making the body fluids unavailable to other body parts. And because it's sodium which is the main determinant of body's fluid status, patients experiencing shock will require greater amount of salt, and it's more dangerous losing salt than losing water, since losing salt in our body decreases the ability to circulate blood around the body, as well as decreasing blood volume out of the heart more than what water can do or what water does. Low sodium intake in elderly people do cause them many health issues, and most of them are diagnosed with hyponatremia, which is associated with lengthy stay in the hospital, risk of death, falls, which can lead to bone fractures, rapid breakdown of muscles, death due to cardiovascular issues, osteoporosis, and unnecessary health cost. Hyponatremia can also be caused by diseases like liver cirrhosis, pneumonia, and acquired immune deficiency syndrome, and many others. We mentioned signs and symptoms of hyponatremia, which are vomiting, nausea, cramping, anorexia, headaches, irritability. We had confusion, disorientation, weakness, lethargy, and bone fractures. While patients with very low sodium can have coma and seizures and permanent brain damage, and as well they can have respiratory arrest and death. Though with chronic hyponatremia, neurological system might not show until serum sodium drops too low because of adaptive mechanism in the brain, and this means one can be working and doing their daily duties with low sodium levels in the blood without them knowing, or without them knowing they have it, and that means they can just collapse anywhere. As we age, hypothyroidism becomes more common and causes salt-wasting kidney problems, since thyroid hormones are key important in the functioning of what we call sodium potassium adenosine triphosphate, which helps reabsorb salt at the kidney tubules. We can as well be at risk of salt loss via blood through medication which are known to us and found over the counter, which increases risk of bleeding, like aspirin, antiplatelets, and oral anticoagulant, including many other. A good number of people in some countries die every year from NSAID medication, which may induce gastrointestinal bleeding, and a higher salt diet may have been able to help. But the sad thing is, many of these people probably they never even knew they had a bleed until it was too late. Individuals who have done colectomies and those with cystic fibrosis, those on keto diets, and the athletes and soccer players needs more salt. Like in soccer players, 1 hour in soccer players do lose a lot of sodium from sweating as well as iodine in their sweat. Those players with restricted salt intake and they continue losing iodine through sweating without replacing adequately, they develop goiter, which is a sign of a severe thyroid problem. Players need more salt and iodine since they exercise almost daily and they are losing sodium a lot, so they need to eat more than others. Athletes can sweat and lose around 3 to 5 liters a day, and between 111 and 185 micrograms of iodine in sweat only, without counting the one they lose through maybe urine and feces. So they need as well to eat more food which is rich in iodine, like food like yogurt. Besides goiter, also through depletion of sodium, it can lead to symptoms comparable to overtraining syndrome, even before lower level of sodium in the blood is detected. And this salt depletion causes the body to work more harder than normal, pushing you into training overload prematurely. Once physical strength starts to falter and the sympathetic nervous system gets so exhausted, the blood pressure drops and may lead to fainting, which is also why depletion may lead to impaired muscular strength and energy metabolic, which raises the acidity of the cells. Cardiac arrhythmias, tremors, muscular weaknesses, and dehydration are some of the consequences of excessive losses of salt and minerals through sweating during exercise. Where also, when you push yourself and you have low sodium and still continue doing high intensity exercise, it increases cramps, muscles fatigue, joint pain, and sleeping like disorders, reduced endurance performance. We have also circulatory impairment and distinct thirst, and all this can be eliminated by increasing the sodium intake. And most of the thirst that soccer players and athletes do experience during exercise may actually be for replacing salt and not water. I see most of them taking tap water. And tap water, yes, has sodium content, but it's not enough or even close to your body's need. So they need sodium much more than just a plain tap water. Athletes with arthritis could experience relief with extra salt because cartilage cells, which is chondrocytes, contain sodium or hydrogen antiphospholipid system. And when you don't have enough sodium in those cartilage cells, hydrogen can build up, and it's not good for your cartilage, even your joint. In osteoarthritis and rheumatoid arthritis, the excess fluid that surrounds and inflamed cartilage cells can dilute the sodium level in the area, which can lead to further pain. And having low salt diet may worsen the cartilage health both in those with and without autoimmune diseases, which decreases the ability to protect their joint and increasing the joint pain, especially during the exercise. And this happened to be worse with the runners since they lose salt from sweating, urine, feces, and from fluids surrounding their cartilage cells, or even from within the cartilage cells themselves. So solution for all this is to consume more salt before and during and after exercise. It helps the body cools off faster, improve blood circulation, and improve the overall performance, as well as reducing fatigue and cramping. Take salt with water, or even taking a dry like 30 minutes prior to your exercise and some after like every hour during the exercise. You will see yourself improving in your performance. And remember to consume salt based on your ambient temperature of your area. The body thus mechanism will tell you when to drink water and how much to drink, and it does this more accurately when you consume appropriate amount of salt. As well, it reduces your risk of becoming overhydrated. Salt restriction reduces the quality of life, and it can lead to weaker muscles and worsening chronic fatigue syndrome, and be harmful to individuals with condition like Parkinson's disease and some medication like statins, which its side effect is muscle pain, and this can make it worse with low salt diet. Low blood sodium level is reduced by high glucose in the blood, since it pulls water out of the cells and into the blood. And also high glucose levels in the blood depletes the body of sodium through increased excretion, and also lower the blood sodium level overall. And those who don't control their diabetes well and have high levels of sugar in their blood may be at risk of sodium depletion, as high glucose can cause the osmotic diuresis and salt wasting and lead to this condition called hyponatremia. And when glucose levels are chronically elevated, giving more salt may actually improve health and even can be life-saving stuff. As we get old, the levels of renin and aldosterone are reduced, and the kidney's ability to retain salt are less. And kidneys that don't function at their optimal level cannot maintain optimal level of sodium as well. So this patient with salt-wasting kidneys require more salt per day so to maintain their stable kidney function. And following low salt intake advice may lead to kidney failure, circulatory collapse, or even death. And structural damage to the kidney can reduce the sodium pump's ability to absorb sodium and excrete potassium. And when this happens inappropriately, high blood potassium can indicate damage to the pumps and can be easier to detect than sodium loss via the kidney. And as the kidney age, the ability to excrete water decreases, predisposing the elderly to hyponatremia. And here, the risk will be of metabolic acidosis increasing, and the extra acid, which is hydrogen ions. When this happens, it needs to be secreted via urine, which it will increase the risk of renal tubule acidosis, then decrease the kidney ability to retain sodium. So patients with kidney disease and also have hypertension may over-retain water or even reabsorb insufficient amount of salt, and that's why this patient may need more salt to balance the high amount of retained water and the loss of salt via the kidneys. But when there is low salt intake, it might impair kidney function and reduce kidney plasma flow and filtration rate. Filtration rate can increase the body's retention of nitrogen, which can lead to death with uremia. And uremia is a condition of fluid, hormone, and electrolyte imbalance in which toxic byproducts build up in the blood. Some medications are cleared by the kidneys, and if one is on low salt intake, the kidneys will reduce that clearance, increasing the concentration of those drugs in the blood, and will increase the risk of serious side effects. Medication like atenolol used to lower heart rate, or dabigatran, which is used to prevent stroke in patients with atrial fibrillation. And this dangerous side effect to the kidneys due to salt restriction are not mentioned by low salt guidelines. But why? Kidneys' primary function is to reabsorb all sodium that gets filtered. And reduction in glomerular filtration does not seem to cause sodium retention. And if somehow the there is a overretention, the liver will signal the intestine to reduce sodium absorption, and both the liver and gastrointestinal system can signal the kidneys to reabsorb less sodium, and as well the body will shunt extra salt into the skin and organs, and possibly into the cartilage or bones. And this is a clear way to show or tell that all these secondary mechanisms suggest that human body is well adapted to handle salt overload but not salt deficit. Beside those with kidney disease, we also have those with hemodialysis patients who lack the ability to excrete salt, and eating more salt may actually benefit them. Also, low sodium intake is associated with an increase in the risk of death in peritoneal dialysis, and hyponatremia is a complication into this peritoneal dialysis. And with this low salt diet and still doing sugar and more sugar, then it becomes more harmful to the kidney as they lead to dehydration, which activates stress and damages the kidneys. And if we continue choosing a low salt intake on top of high sugar intake, that will be a perfect formula for damaging our kidneys. While dieting on carbs, you'll need more salt, especially during the first 2 weeks of diet, as I mentioned earlier, since high level of ketone, it means greater release of glucagon and lower level of insulin, all of which occur on a low carb diet. Also, it increases our excretion of sodium. And one might experience symptoms like fatigue, dizziness, and carb craving, which can be improved by adding more salt intake. Prolonged fasting on low salt intake pulls sodium from body stores to replenish the exchangeable sodium place. And it may put one at a risk of osteoporosis, as sodium is an important component in bone formation and is being depleted when one is doing a long fasting. For infection, without salt, the skin won't be able to effectively get rid of pathogen, as a hypertonic environment increases the production of nitric oxide, helping eliminating those pathogens. And taking more salt may help diabetic patient heal skin ulcers, which is a common complication in these individuals. And besides skin helping fight infection, also high concentration of salt in lymphatic organs like thymus, spleen, nodes, lymph, and inflated tissue may help the body fight off infections as well. Another benefit of high salt diet can also help in sepsis, as hypertonic saline increases the T cell function, and may also help in other systemic infections like HIV, Ebola, and hepatitis. The food that is packaged with low version may have higher microbial counts, increasing the risk of food poisoning and foodborne illnesses. And lowering the salt in food packaging may require higher use of suspect preservatives such as phosphate, nitrate, nitrates in order to maintain microbial stability, which is more dangerous to our health compared to salt. We have some more conditions where patients need more salt. Condition like autism. Some theories suggest that autism could be a disorder of overhydration, and with less salt, there could be blood depletion of certain essential brain nutrients like taurine and glutamine, which could be the reason patients with autistic disorder tend to crave for salt more and more. So this patient could benefit more by consuming more salt. We also have these conditions like Bartter syndrome. We also have nephropathy. We have hypotonic hyponatremia. We have euvolemic hyponatremia. We also have autoimmune Addison disease. They all need more salt. We also have nicotine. All those stuffs that contain nicotine have an increased risk of low sodium in the blood level, since nicotine has the ability of increasing water retention through increased production of antidiuretic hormones. When you are hungry, most of the time, you store fat around your middle. And if you have low salt intake and high sugar intake, you may be worsening your underlying insulin resistance. And the increase on insulin's level could be nudging you towards internal starvation. And afterward, it may mean your body is oversecreting insulin and causing the blood sugar to crash, especially if you have non-alcoholic fatty liver disease. Health facility must stop that thing of, if you have high blood pressure, the first thing they recommend is to cut on salt intake, instead of them advising on cutting on sugar. While many patients can be saved by not cutting their salt intake. Let patients' internal salt thermostat control their taste buds in order to raise or lower their salt intake, but not by force. And for those who are ingesting more salt than normal, it's more likely it's your body telling you that you need the extra pinch for optimal health. If we can train ourselves to stop drinking sugar and cut on sugar from our diet, and if we try and stop drinking liquid, added sugar or free sugar stuff, we can save ourselves from a lot of diseases. Liquid sugar is worst because it's rapidly absorbed and then leads to worse metabolic consequences than solid sources. And when we avoid salt in our food, we will tend to eat more throughout the day, to consume more food to reach the salt level the body demands until it hits the mark, and it may mean more kilos in the near future. If you're exercising or you are a gym person, don't limit salt intake, since it can cause circulatory collapse and it may decrease the gains. Salt is the gateway to stronger muscles, stronger stamina, and increasingly perfect physique. So, stop restricting salt intake, because your insulin levels can start to drop towards the normal range, and your body will start to access its stored energy and will burn more fat. And our bodies will use the calories we consume from food for energy, rather it will be piling calories as fat. While your salt-retaining hormones will go down, improving the sensitivity of your fat cell to insulin, because fat cell can begin to absorb any extra fat and glucose where it's supposed to go, instead of being driven into our bellies and our internal organs. And it will cause your brain to become more sensitive to leptin. And by that, you will avoid getting into a state of internal starvation, and you will be able to regain control of your weight. And this will make an end of you being thin on the outside and fat on the inside, and move towards being thin on the outside and as well thin in the inside. So by eating healthy and natural food that are high in magnesium, calcium, potassium, and salt, you will eliminate all these kinds of stuff. So always remember, as I wind up, salt restriction intake can lower blood pressure for only a period of time. But while blood pressure is low, the circulation will be low as well, and the organs will be working harder, while oxygen and nutrient supply to the organs will be lower as well. So salt restriction is not a solution for a long-term thing. And as salt restriction take place, then it will raise heart rate. So when we get reduction of blood pressure of 2%, then we get a 10% increase in heart rate. So which is more harmful between the two? Increasing the heart rate will add stress in the heart and arteries, leading to heart failure, hypertension, and cardiovascular issues. And when you avoid salt, then you will be increasing hormones that are known to enlarge and stiffen the heart and arteries. Government needs to add more tax on refined sugary stuffs, sugary beverages, junk food, and tax less on healthy natural foods, and we will be able to make a healthy nation. Always remember, you can live without sugar, but you cannot live for long without salt. Now you see, there is no relationship to the blood pressure and salt. And salt-dependent hypertension is not strictly controlled by salt, but it is controlled by aldosterone, norepinephrine, and epinephrine. Guys, let's continue adding more knowledge every day. See you next time.